Today I shall record ectopic pregnancy.
Yeah, it's one of 3 topics we're going to talk about hemorrhage in pregnancy. Yes.
Yeah.
Okay.
Causes for hemorrhage in early pregnancy are ectopic pregnancy, hydatidity mole, and intrauterine abortions. Ectopic pregnancy is one in which the fertilized ovum becomes implanted in a site other than the normal uterine cavity. Incidence: 1 in 300 to 1 in 1000 of deliveries, depending on the prevalence of pelvic infections, that is gonococcal, post-abortal, tuberculosis in any community.
So the communities with high rates of gonorrhea and pelvic infections have higher rates of ectopic pregnancy.
Sites: fallopian tubes is the commonest site. Second, ovary, abdominal, cervical, broad ligament, rudimentary horn of a bicornate uterus. Commonest site is tubal. Tubal pregnancy, etiology. Normally, fertilization occurs in the ampulla of the fallopian tube, and the fertilized ovum migrates to the uterine cavity by the ciliary action of the epithelium and peristaltic movements of the tubal muscle. Factors which are responsible for the fertilized ovum to remain in the tube are factors preventing or delaying migration of the fertilized ovum to the uterine cavity. Second, factors facilitating nidation of the fertilized ovum in the tubal mucosa. Now let us know something about factors delaying and preventing migration. As I have already told, chronic inflammatory disease of the tube in 50% of the cases, like post-abortal, puerperal, tuberculosis, gonococcal infections. These infections cause loss of cilia of the lining epithelium.
The inflammatory process causes death of the cilia.
Yeah. And impairment of muscular peristalsis. Also, narrowing of the tubal lumen can occur, formation of pockets due to adhesions between mucosal folds, peritubal adhesions resulting in kinking and angulation of the tube, developmental defects of the tube like elongation, diverticula, accessory ostia, distortion of the tube mechanically by fibroid, broad ligament cysts, and ovarian tumors. Now, iatrogenic causes for ectopic: tuboplasty, intrauterine device, tubectomy. Transperitoneal migration within and external migration, ovum fertilized in the perital cavity and cross the pelvis to opposite side.
So you're saying it could get fertilized here and it could travel over here. Could it ever get fertilized here and travel through the uterus and end up here? That's the next theory we're going to discuss, yes?
External migration is
outside the uterus. Internal migration in the uterus.
In the uterus, correct. Internal migration is rare. Now there is one theory, Iffy's theory, quite interesting. Delayed ovulation and fertilization. Hormones are not suppressed, so menstruation occurs, and menstrual blood pushes the ovum back.
That's very interesting. So it have to be a perfect storm of events. You'd have to have irregular menstrual cycles and delayed ovulation, and then delayed conception, and then early period, and then it
pushing back.
Has there been any confirmed cases?
No.
No, it's just a theory.
No, because confirmation means Finding of corpus luteum.
Right, they'd have to do intense invasive studies.
Like that. Nothing.
There's no way of knowing. We can't retrospectively. But it's just an idea someone had, and maybe it makes sense.
If his theory, that's
Yeah, yeah. You think it's true?
It may occur.
May occur. Huh. Seems like it.